Hi, guys. This is Dr. Nisha Chellam from Holistic Icon, where this is the best place for what we say, where we understand the science of disease and the art of healing. So I'm here with our integrative nutrition coach, Marina Schonefeld, who will co-host this with me and will stick around. And I would really recommend that you stick around till the end because she's going to give you some tips on what we call as food as medicine.
Yeah, exactly. Food as medicine. Thanks for joining.
Yeah. Thank you so much for those of you who have joined us and those of you who will join us. Hopefully the information, what we're going to give you is going to change your life. That's our goal. So this being our first podcast, one of the things I want to address in this is what do we do as a practice, as a medical practice, and why do we call ourselves a functional medical practice? What is functional medicine actually all about? And really, how can we claim that we can help you find your best doctor, and that is always you? So those are the things we're going to address in this very first podcast, and we're very excited because this is something that we had planned for months together, and we just decided we're going to start. So here's what I would say when it comes to the kind of medicine we practice. I really know the reason why everyone has a health issue or a disease process, whatever you want to call it. And the key about that is I have to tell you, I know you're thinking in your mind, oh, yes, it runs in my family, therefore that's why I have a health issue. It's really not your genetics. It's not that crazy job that you just hate to go to. It is really not your spouse or your kids. It's not, what are the other excuses that we get normally? It's
stress,
yes. My job is stressful.
Lack of time is a big one.
Yeah, I don't have the time to exercise, therefore I am sick or I gain weight. Or I don't have the time to cook, therefore I have to buy fast food and that's the only thing that's affordable. These are the things that we tell ourselves as to why we are not in the state of good health or have a disease process. And I'll tell you, I know the exact reason why you have a problem. And the reason is really in the mirror. If you look at the mirror, the person looking back at you is the only reason why you're sick or you're healthy. And sometimes the truth is very brutal. I've done this now for, I think, 22 years. All the time, it just comes back down to what is it that you are thinking, how you do things, what you drink, how you eat. Everything matters. You have internal and external stresses. And we'll get into the details of this. So a lot of times when you give yourself an excuse, it's because you're comfortable where you are. And really the common excuses people tell us is you don't understand. Like, this is my life. Here's what I understand. You cannot change anybody else in your life, but what you can change is how you react to everything around your life. I hope that makes a lot of sense to a lot of people. But usually when they come and sit down with me, when we have that discussion, I think they do realize at the end of it, it's how they react and what they do and how they respond that really impacts their own health. So 100% of what is happening in your life today is a choice you've made. I think you really need to understand that part. Because if it's not a choice you made, you may say, you know what, lupus is not something I chose to have. It runs in my family. My grandmother had it. My sister has it. My mother has it. And it was only natural for me to have it. And this is where I will tell you a story. 9 of my aunts and uncles have diabetes, including my mother. And 4 of them have died from complications of diabetes. My aunt died of gangrene, which was following an accident, and she was a diabetic. One died because of chronic kidney failure. Another died due to a stroke. So what I want you to understand, these are all things that for me, when I started my journey in the health pathway, in the healthy pathway, I was a pre-diabetic and I had started taking metformin because I'd accepted the fact that it runs in my family and this is how my life is also going to evolve and this is how it will end with these disease processes. What occurred to me at that time is I was in my 40s. My uncle and aunts and my mother, they were in their 50s when they got this, late 50s and early 60s. So I was almost 2 decades earlier when I got the disease process. What I had to shift were a lot of things. So 100% I had to take responsibility for the choices I made, whether it be my job, whether it be what I ate, whether it be the excuses I gave to myself for not exercising. So those choices kept me in a state that I had at that point in time. And when I made different choices, I had different results. I hope that makes sense. If anybody is on, I just want you guys to let us know that you are on, and if you have any questions, go ahead and ask them.
Yeah, and so in the meantime, kind of the reason that we're explaining this to you is because when you go with the regular medical system, it essentially puts you in a box. And it makes you think that, this is what is going to happen to you, and this is your path, and there's not much you can do about it other than maybe delay some of the processes a little bit. So when you kind of look at it in terms of you have the control, which is really what we teach here, is that you have the control and you have the choice with the education. You can change your future, your disease process, and really go backwards towards wellness. So yeah, it sounds kind of harsh, but really, like, once you take that responsibility, that's what functional medicine is all about. And that's a distinction between functional medicine and, for the most part, the regular medical system.
Yeah, absolutely. Because, you have to look at how the regular medical system actually evolves. When you look at how do you distinguish regular doctors from the other healthcare providers? So the way the regular medical system is different from a functional medical or a holistic doctor. In the regular medical track, the first few years we learn about the body, the anatomy, the physiology, the biochemistry. But the most interesting aspect of any medical training is when we learn how to put the symptoms together and come to the right diagnosis when it comes to the disease process. And then even more exciting is how to get the right drug connected to the disease. So when you train continuously where disease is inevitable, that's how doctors are trained, that we believe disease is inevitable and everybody will get it. A functional medical doctor really gets a different training track where they believe and they know that disease is actually a choice. And all you need to understand is the journey, it is a journey to illness, and therefore for you to become well, it should be a journey to wellness. And when you really choose, and I have no idea why our emails keep popping up, despite it being closed.
Okay. Always the best timing.
Yeah, I know. So we have to remember to next time to close the email before we start our podcast. So here's the question I have for anybody who's listening or watching this. Do you have insurance? If you have insurance and if you've made visits to your doctor, do you feel you've gotten well? I have patients who've come to me on my insurance practice on a regular basis for high blood pressure. And no matter how much we help them with their medications, we keep adjusting their medicines, and they believe those medicines are the true treatment for high blood pressure. What if I told you high blood pressure is the way your body protects itself from an underlying problem, and the medicines actually work against your body? I'm not saying stop your medicines. I'm just trying to say is medicines should not be your first line of treatment. Try to get to the root cause. So this is what happens to a lot of people. They go to a lot of specialists. They go specialist after specialist. They come up with no answers. All of their blood tests are normal. Then finally somebody tells them, I exactly know what you have. What you have is fibromyalgia, and here are your medications. I can tell you the relief people have. Finally, this doctor has diagnosed me with fibromyalgia. What you fail to realize at that point is all you got is a name to your symptoms. You did not get a resolution of your problem, right?
Mm-hmm.
And then you're stuck with this medicine. Let me ask you to think a little differently. What if you got the name, but you actually, instead of knowing just the what, how important would it be and how cool would it be if you actually know the why? Because once you get to the root cause, you can actually work towards resolution. How many of you would resonate with that? And I am trying to see if someone is answering that question. Let's look at, if anyone is out there listening to this, just type and say yes or no. Hello. I can see
Oh,
Pam. I see Betsy Miller. Hi, Betsy. Finally.
You got a
And
wave from
hi,
Leslie.
yeah, hi, Leslie. I'm sure you're busy and you're trying to take a peek at this. But here's the question: the question that we asked: if you actually can resolve your health issue by getting to the root cause, would that not make more sense rather than just saying, you know what, I got diagnosed? Because when you look at the traditional medical system, the way we're trained as physicians is to diagnose a disease. If we can remove the piece, the organ, we will do so. Or if we can give you a medication, we will do so. That's what we're trained in. But the healing process, there's only one person that can do it, and that's you. Because your internal and external stressors are unique to you. I hope that makes sense. Because this is something that I wanted to tell you about. I was talking to a physician over the weekend, and he was saying one of his training, his professors used to say, when you get a consult or when you have a patient calling for an appointment, make sure you get them in as soon as possible, or you make sure you get to the consult very soon, because if you let too much time pass from the time the patient is trying to make the appointment for a problem, they will actually resolve their problem on their own. So try to see them fast so your business continues to grow. It may have been said as a joke, but that is the truth. The truth is if you feel your high cholesterol is due to a deficiency of your a statin or a cholesterol lowering medicine, you've missed the boat. If you feel like your doctor is the one who has to diagnose and treat you and you have nothing to do with your health, you really are missing the boat as far as when it comes to health. If your doctor feels like, I know what is wrong with you and I know how to fix it, then as a physician, we're missing the boat too. So the attitude should be that we work as 100% partnership. You do your part. We try to help you or steer you in the right pathway so that you know the next step is actually towards health and not just managing the symptoms. I hope that makes sense. So is there something else that I've forgotten to explain what functional medicine is?
I think pretty much in summary, the main thing is your conventional medical system. You're put in a box with your disease diagnosis, your drug, or your surgery. And that's basically the trajectory there. And it's all pretty much, what is this drug? What is the surgery that we can do for you? And that's where it ends. There's really not very much responsibility there other than taking that medication probably daily, hopefully. Some people don't do that even.
Yeah, I know.
Versus when you look at functional medicine, it's a lot of work, and it's about you as a person and your story and your history and your background. Everybody's an individual, and that's really the difference. But with that comes the responsibility that you have to put into it. We can't cook for you. We can't shop for you or make the time for you or make any other changes for you. But what we can do is provide education, provide guidance, support, and all that positive stuff usually.
And also get to the root cause. A lot of times if you don't know why something has to change, and people will come and say, we do a lot of testing. The testing comes back negative, let's say, and we go through a detox process. They remove certain food allergens. I'll give you an example, gluten. Let's say when I eat gluten, I don't have any problems. But they're looking for problems in the traditional sense of the gluten, right? You eat gluten, you have a bloating sensation, you have cramping, you have diarrhea, then that's gluten sensitivity. What if gluten, this is something you have to remember, something like gluten or eggs or milk can actually give you a skin rash, can actually give you brain fog, can actually give you arthritis. You don't realize those things actually stem from you reacting to a food substance. And the reason you react to a food substance is not because there's something wrong with the food substance, though that may be true in today's day and age. But it could be because you don't have the right kind of gut bacteria, which we will talk about. It's a whole podcast on gut bacteria and how the significance of gut bacteria in our health and disease process. But right now, what you need to understand is it is not very simple as people always come and tell me, I've removed gluten, dairy, and soy. It's not what you removed that determines your health. It's what you are doing in the moment. And that's our job, to figure out what is it that you're doing, which means you have to be honest about it. Number two, you have to be willing to make the changes. And as we do the changes, we also have to look at the root cause of why you have a disease process. I hope that makes more sense than just saying, go to a regular doctor, see what's wrong with you, get a diagnosis, and take the medication. because that might be the first medicine you take, and it might be the first of 25 other medicines you're going to have to take in order to actually sustain your life or your living or your health. And you'll find your numbers get better, your diabetes numbers get better, your cholesterol numbers get better with medications, but you actually decline, your health declines. So health truly has to be sought. Just like wealth has to be sought. You have to do certain things in order to get wealthy. There are certain things you have to do in order to get healthy. It's not a simple fix as just us giving you a diet sheet. A lot of people come and say, you'll do the testing, you'll give me a diet sheet. I wish it were that simple. Because we can give you a diet sheet, and tomorrow if something is not on the diet sheet, you're still going to eat it because you don't know a different way. It's not sustainable. And I think if you Google today, you will find enough diets out there to work with. So really the way we teach you to be your best doctor is, number one, you take 100% responsibility for your choices and where you are in life. Number two, you do understand that you have to make some changes, because you continue to do what you've done, you'll continue to get what you've gotten. And those are the changes. Number three, we are here to help support you as a team through the change process. And at the end, both of us have a goal, and the goal should be in alignment, whether it be, I want to be better with my thyroid, I want to actually lose weight, I want to actually sleep better. You can sleep better, we'll give you all the tools, but if you're still watching TV just 5 minutes before bedtime, your sleep is never going to be effective enough, or there could be an underlying problem. So those are the things we have to address. And other than that, the only other way you would look at it is, if you didn't pay taxes to the IRS for 30 years, do you think the IRS, when they eventually find out, they're just going to say, you know what, you didn't pay in 30 years, now stop paying? You have a penalty to pay. And this is what happens when you have a disease process or when you have symptoms. You have a penalty to pay, whether it be in the form of disease management or health recovery. And the choice is yours, what you will do. So make sure when you are seeking out a functional medical practice or a practice like ours, that you are 100% on board to make those changes, and you are in 100% partnership with us. Is there anything else I have missed other than?
No, I think that sounds pretty good.
Yeah.
Hopefully not too overwhelming.
I know, right? Because ultimately, this is what we always say. Disease is not inevitable. It is a choice. It is very similar to debt management, whereas health is your new wealth. And as with anything else, health is a choice, and you have to seek it out. I hope that makes sense. And I hope this is just the beginning of your education. And we are hoping in the next series of our podcast to help you think a little differently. And before I wrap up, I'm going to have Marina give a quick tip on food as medicine. What are you going to talk about today?
We'll talk about ginger today, which is one of my favorite things to put in just about everything.
And she's not kidding about it. She actually put, what did you put, a pound of ginger in one of her smoothies?
It wasn't that much. It was like 2 inches.
Okay.
Yep. So ginger is actually a root. It's commonly used as a spice. You can get it fresh or you can get it dried. You can also get it in a tea. So the main health benefits is it's huge for anti-inflammatory benefits, and it's a very high potent antioxidant state. So what it can help with, you guys might have heard about this, with the morning sickness. If you're pregnant, really great for that. Nausea, also digestion. And it even helps to prevent and fight colds and flus. So in the summertime now, you guys might not need that, but keep that in mind for later on.
Yeah.
So you can also get in a supplement form for those things. But the best way to do it is just to get it raw, get it fresh, go to the store, get it in its little natural root form, peel off the outer bark of it. You can throw it into a smoothie, just cut off like a little bit of it, a lot more of it if you like spicy things. Throw it in there, throw it into your smoothie, or otherwise you can grate it into like a stir fry or into a curry. Goes really well with any kind of coconut base, actually. So lots of things you can try it out with. You won't mess it up. Just go buy it and throw it into something, see if you like it. If not, just use a little bit less.
Yes. Then carrot and beet soup, you can add ginger to it. It really tastes good. Leslie, I have your question. Can gluten sensitivity be fully reversed if your reaction is very high? So the answer to that is the reason you have gluten sensitivity is not because of the gluten, though we think a lot of it is the glyphosate. I don't think anybody really knows, but it is because our gut bacteria has changed over generations. Our ancestors were not reacting to gluten as badly as we do because our gut bacteria has become completely confused and they're very muddled. They don't know how to handle a lot of the foods we eat. And a lot of times gluten comes in the processed form. When you really look at it, look at the breads or look at the cakes, it's highly processed. The sugar is very processed. So we really don't know what it is, but we have to shift the gut bacteria and see if you can handle the gluten. And the way you would know that is when you have no signs of inflammation, you're not struggling with sleep, you're not struggling with weight, you're not struggling with any skin rashes, really no disease or symptom process. I hope that answers your question. So it does take a long time if you're trying to reverse it, especially if you acquired it. It's very different if you have a genetic trait for celiac and you are a celiac and you have no, the intestinal villi, to actually handle the gluten or the enzymes to break it down, then that can be a problem. So, well, thank you guys. We don't want to take too much of your time. Thank you for staying with us, and we will be back next.
We'll be back next Thursday. The edited version of this podcast will be out on Tuesday, so you can follow along there. Otherwise, go to our website, holisticicon.com. We've got a lot of blog posts on there as well. So all about education. Send in your questions, and we'll see you live next Thursday.
All righty. Take care.
Bye-bye.